Welcome to the Telehealth hip exam. Initially, have the patient tuck in their shirt to avoid blocking the hip joint area. Make sure there is at least 6 feet in front of the camera and space behind them to assess gait. First, we're starting with standing pelvic obliquity, noticing any left side down, right side down, or neutral position. Next, any thigh edema that is present. So have the patient pull up their shorts and see if there's any associated thigh edema on either side. Next, have the patient stand perpendicular to the camera and what's called standing flexion contracture. A positive test is if the patient leans forward, potentially indicating hip flexor tightness. Next, have the patient go to the back of the room, and here we're going to be assessing gait. At a comfortable pace, have the patient walk in front of the camera, assessing for an intelligent gait, normal gait, or what's called Trendelenburg, where the hip seems to dip with every step. Next, have the patient do the same thing but also on their toes, and then on the way back, you can have them also do this on their heels, assessing their inability, their ability, and ability with difficulty. Next, have the patient grab the chair, and at a 45-degree angle, we are testing for leg lengths. In a seated position with the knees extended, we are going to test for equal lengths, left leg long or right leg long. Here, in the same position, we will test for maximal active flexion while seated, having the patient pull up on their knee as far as they can, testing for active flexion of the hip. Having the patient facing you, we will now do active internal rotation and active external rotation while seated, testing to see if they're able beyond neutral or unable beyond neutral, doing internal and external movements of the hip. Here we'll also do one special maneuver while seated called the active sitting Faber test, having the knee flexed, hip externally rotated and abducted. See if there's any pain at this area. And if there is pain, assess if it's in the groin, the SI joint, or the trochanter. Next, we can have them do this on the contralateral side and have them just rise from their chair without using their arms and their ability to do so. More special maneuvers include what's called the C sign. With the index finger and thumb in the anterolateral position, a positive test is pain in the anterior hip flexor or posterior buttocks. Next is pain with self-palpation, having the patient stand in a perpendicular to the camera, assessing pain in the buttock region, greater trochanter, or IT band. Next, have the patient set up for some floor maneuvers. If they're able to have a mat, definitely highly recommend, but if not, the patient is able to lay on the floor. Making sure the camera is at a good angle to be able to assess range of motion on the floor for these special maneuvers. First one we're going to start with is active abduction in lateral decubitus position. With patient on their side, have the patient try and lift their leg against gravity. If time permits, have the patient switch and do this on the other side. Next is the Thomas test. Having the patient grab their knee and bringing it towards their chest. A positive sign is if the contralateral knee and hip lift off the mat. Next is the straight leg raise. Keeping the knee in extended position, having the patient lift their leg off of the mat without issue is a negative sign. A positive sign may indicate lumbar radiculopathy. Next, we'll be doing what's called the Draymond sign, having the patient turn their mat where the head is closest to the camera. This test examines for slipped capital femoral epiphysis. Having the patient passively bring their knee up into their chest, and if there's automatic external rotation, is a positive sign. This concludes the Telehealth hip exam encounter.